This next presentation, it's going to be Scott and I talking about our coalition. So let's start Scott up.
Cool. All right, good morning. Thanks for coming back for day two. I hope day one was successful. Again, I'm Scott Chambor, Alaska Coalition on Housing and Homelessness Chair. And one of the things that I think the coalition has been really successful at, if you've attended any of our conferences the last 5, 6, 7 years, is we've been really excited about the work that's being done throughout the state. So we talk a lot about policy, a lot about individual programs, a lot about conveying information and trends that we felt are important to for communities and agencies and service providers to understand. But we have not been very good at talking about ourselves. And if you've met Brian, will avoid that kind of topic like the plague, because he's so passionate about the work that you guys are doing out there in the field. But we felt like it was important for this group, as the membership of the state coalition, to kind of reset a little bit about where we are as we move forward together. So again, just a brief history. I don't want to spend too much time here. The Alaska Coalition on Housing and Homelessness started in the mid-90s. It's been really, for the first iteration of the board, it was a volunteer board all the way up until we hired Brian in 2016. And its main activities through those first early years was to have general membership calls every other month, have the annual conference where there was a lot of reporting out. And that was the key activities. It was a loose networking group that came together once a year to kind of talk about some common activities going on throughout the state. There was a pretty monumental shift around 2012. I started participating with the board in 2010, and I think 2012 and 2013 were the years that the coalition board really took kind of a stance that, wow, there's a lot more that could be done on the statewide level to address housing and homeless issues and to provide technical assistance throughout the state. I think Dave Rose was the only member around back in 2012, but it was a pretty monumental set of discussions and retreat type of activities where we really came to the conclusion that we needed to do more. Also at that time, there was palpable disgruntlement with the representation of the entire state on the state coalition board. If Dave remembers, there was kind of a run of Fairbanks individuals who basically said they were going to be massively represented on the state coalition board, and I think about 15 people from Fairbanks applied for 2 spots because they were adamant that Fairbanks was going to get more representation on the state coalition board at the time. And I think that's important to start off with here as well, because of Chris' presentation too. A representation on these issues in rural and semi-rural communities is really important. We've done a good job within our board, but again, the power structure at that time, if you thought about it, the Alaska Council on the Homeless was 2/3 Anchorage-based. The State Coalition Board was 2/3 Anchorage-based, and all of the major funding and policy makers are based in Anchorage. And so one of the things we resolved ourselves to do at that time in 2012 was to make sure that we were advocating on behalf of all communities and representative it in all of our activities. Also at that time, we recognized, wow, communities are all different as they approach this issue. Some are interested in just getting some information on emergency shelters because they see a couple of people in their community now hanging around. Other people are more holistically approached and said, hey, we need some more housing and more supported housing for the chronically homeless. We garnered a lot of questions as to where to go for answers on homeless policy and potential guidance. So we harbored a lot of technical assistance that we felt was not being provided and that the coalition could play that role. Also at that time, there was huge changes to the HUD COC program. HUD really wanted more community stakeholder input into the funding prioritization as well as the process of granting funds to projects in the community. Up until that, the HUD COC program in the state was really run by one person, Chris Duncan, who was at AHFC. But she had talked to us about taking over the community organizing responsibility because it was important to scoring and getting funding later, and we agreed to do so. And then the other piece, much like we've talked about as earlier, there was relatively little data on homeless populations outside of Anchorage. The way the data was collected really up until ICA came on board, you could get numbers broken down into Anchorage and balance of state, and that did not paint an appropriate picture as communities were starting to want to address housing and homelessness on the local level. So at that time, it was really instrumental that we make some significant changes, and just fantastic work by the board to say, hey, we are indeed going to do more as an organization. Given that we are an all-volunteer board with little expertise in the biggest geographical continuum of care in the country, we took a slow build approach. We were not experts in any of the HUD COC program and language. We were not experts on housing first, permanent supportive housing. But what we really committed to was taking a slow approach to learning all of these technical aspects of building a complete housing and homeless system in a state like Alaska, and that we were going to lean on best practice and expertise as we can find it. And you'll have seen that over the years that the coalition has provided, constant information from the USICH, HUD, National Low Income Housing Coalition, and really made it a priority to get as many people in the state to the National Alliance to End Homeless Conference every year, because that's where all of that technical expertise can be brought to the state. So at that time, we changed our bylaws to indicate all of this new philosophy and changes. We really had to start from scratch with building the COC. Again, Chris Duncan, a huge wealth of knowledge, but she did retire, and so we had to garner that expertise in-house. We focused on recruiting the diverse voices, as you can see by the representation on our board. Brian and his work throughout the state in the last couple of years has been really good at reaching out to rural communities as well as the public housing authority or public housing sector. And you can see that on our board today. We've also focused on maintaining much resources as we can for our balance of state programs. There is opportunity to take resources from our Continuum of Care grant for the purposes of operating the coalition, but the board has stayed away from that. Since we get so few funding from that program, we want to make sure that that goes out to people and houses them and provides services. We've had this approach that we've always been transparent and open, rely on collaboration as much as possible because we are so small and lean. You can't play a whole lot of games when you only have one staffer that has a job description for about 6. So we've had this, this approach throughout. And then we also recognize that this was a slow moving progress. We're building an infrastructure that does not exist in the balance of state of Alaska. And we were trying, again, as I said, do it with minimal staff. We did hire Brian in 2016 with the grants that we received from the Alaska Housing Finance Corporation and the Trust. But even during these years in 2013, we kind of did have staffing. I was in Brian's role when I worked at the state. It was in a different position, but I spent a good majority of my time doing coalition work. So in effect, we have had staffing. It wasn't actually paid through the coalition. It was through volunteer and other time. So this work was only able to be done, with a level of staffing to oversee this progress in the state. Okay, so the next step as we finalized the historical piece, we started moving really quickly. Again, the lack of data piece was huge, so we entered into a joint HMIS contract with the Anchorage Coalition that still exists today. We had a joint meeting with state funders at the time to say, hey, we're making some progress. We want to build this for the future. It provides you with reliable information so that you can make policy changes and policy decisions in the future. So we've secured a 3-year grant to hire staff. We looked at ways to buffer operational funding through the activities that the coalition it partakes in. And again, as I mentioned, the primary public conversation that we have is through advocacy days or the conference. So we had a committee for a number of years looking at ways to get more money through dues or sponsorships or memberships. But what we found out is that it counteracted with our goal of recruiting as many people to this cause as possible, because membership dues and annual subscriptions and high conference fees does not work for your organizations as we try to get you in the same room as possible. The gain from those efforts was so minimal, but it was really difficult for the agencies, and we saw participation drop off, and so we've kind of scrapped away those models currently. So therefore, everybody who participates is a member of the state coalition, because we think that's really important to build the network in the balance of state. We have secured COC dollars annually and dealt with the difficulties of sequestration. So when we talk about state budget cuts through the HAP and SNUG, well, we felt that in the COC as well. Taking 8% from the 12 programs in the COC around 2 years in a row was not a fun activity, but we were able to manage our way through it. And then again, we've held conferences each year, including adding the Alaska Council on the homeless to the agenda, as we've held those in Anchorage to ensure that more rural advocates and service providers engaged with that policy-making body consistently. And so now I'm going to turn it over to Brian to talk a little bit about these activities going forward.
Sure, thanks, Scott. So I'm going to be kind of brief, but one thing we get all the time, and Jasmine probably gets this too, is the question, what the heck is a COC? What do you guys do? That's a good question. It has a really long answer to it, but I'm going to try to answer it in a couple slides and talk about kind of the level of work that hits our desk. So there are 404 different COC organizations in the nation. They're basically regions that HUD has, and there's only 2 in all of Alaska. And that is a challenge because if you are familiar with Alaska, which you are, you understand that, one, Anchorage has about half of the state's population roughly in their area. And then in the largest geographic area, state area in the nation, the rest of the folks are spread out, and we're disconnected. We don't have transportation to many of our communities, ground transportation. And so our coalition is taking on a responsibility of planning a homeless response system, trying to figure out how to get better data, try to convene general membership in a really challenging environment. A lot of folks think that we are a state entity, that we have this government money to help us with this, but in reality, we're both 501c3 organizations. We've traditionally been funded through state funds, say through Alaska Housing Finance Corporation, or through a little bit through our federal continuum of care planning. But at the end of the day, it is a big responsibility of us to, approach funders and get them behind a lot of the efforts that we have. So what do we do? A lot of folks think that, oh, you're the COC, so you manage that grant program, right? That pays for my permanent supportive housing or pays for our wrap-re housing. It's like, yeah, that's definitely an element of it. But we are tasked as an organization to do a lot more than that. If it was just a funding stream, it would be so uncoordinated, there wouldn't be any strategy behind it, and there wouldn't really be much of a purpose for a COC organization. That could just be ran through one person at the Fed level. But we actually kind of split this into operational, planning, and HMIS activities. We've all heard about coordinated entry. This is basically the system, the policies that we set in place for how our clients access services. Where are they accessing them? How are they being assessed in a fair and objective way? How are we prioritizing resources to get out to our clients? Because we all know that we don't have enough to help everybody, unfortunately. And that's been a big task of our coalition for the last 2 to 3 years. We passed our first set of coordinated entry policies 2 years ago. We have in the balance of state 4 referral zone regions right now. We're still trying to figure out how to add additional regions in our more rural areas that don't really have a robust response system in place. And we're about to start reviewing and updating those policies going forward as we work with the YHCP grant, which we'll get to in a minute. Convening general members, obviously, as Scott mentioned before, that has a big cost to it. It's challenging. To be completely honest, about 75% of our conference budget is going towards the travel scholarships. We're operating on a very small budget to put on this activity that just got reduced this year. So it's not really a moneymaker for us as a coalition. Monitoring and evaluating our homeless response system, that's a big piece of what we do, and it's important because that helps us bring in additional funding going forward, and I'll get to that in a second. And then providing technical assistance. When I first started, I talked about this a little bit yesterday, but a big way to make these improvements and establish relationships is to get into communities. There is no way that I would understand what the uniqueness of Nome is and their challenges of having folks sleeping on a seawall and that's their only option when the shelter closes, or the unique challenges that Bethel is facing, having 51 villages that feed into their hub community. Or Fairbanks, knowing that they're serving such a huge region in interior Alaska, it can sometimes take 2 days to get out to a village. There's no way that we could, as a body, understand all those complexities and set policy if we can't get into those communities. And one of the challenges we're really facing right now is, and everybody's kind of facing challenges with the current fiscal state, is our ability to do that is getting very limited at this point. I feel like the success that we've had over the last 3 years has been from being able to go into your communities, bring together town halls, bring our best practice expertise, and get folks kind of moving in the right direction. And that has had a financial benefit to the programs and agencies across the state over the last 3 years. Planning, our annual COC NOFA is a big, the NOFA stands for Notice of Funding Availability. That's a big activity that we do from May to usually September-ish. It's not just asking you to apply for your continuum of care grant funding. We put together a pretty substantial collaborative application as well that's really describing our homeless response system as a state and what we're doing to show HUD that we are following best practices, and also really putting in our system performance measurements that we get judged on against the other 404 communities. We do gaps analysis. Gaps analysis in rural Alaska is pretty easy when you don't have a whole lot of stuff. So, but it unfortunately, if we don't have a body that's really highlighting these things, talking about what Chris highlighted this morning, who is talking about that? And so that's something that we take very seriously and try to get up on the big stage as much as we can with our folks over here on the Hill, with our other stakeholders to really spread the word. And then point in time count. Luckily we have a great organization in ICA that does a lot of the coordination. Shout out to Holly, she's back there, for this. But it is really challenging to organize these annual counts and the housing inventory counts, tracking down hundreds of different agencies and making sure that they get their data in on time. Sorry for cutting your timelines a little short this year to get that data in, but we really wanted to rush and get that up as soon as possible. And then setting policy around the HMIS system. So ICA, really administers our HMIS software and does all the trainings, provides really great resources. There's a whole other side of it, of policy, that we have to keep up with. And right now, Jasmine and I both have 9 documents on our desks right now that the AKCH2 Advisory Board have been working hard on for about 6 months or so, some of those documents for more than 6 months, that we have to review and get in front of our boards this next month. So there's this huge amount of work that COCs do. And Scott mentioned, it's not really funded through our COC funding program. And this is a common problem throughout the entire nation. But when you're talking about balance of state continuum of cares, it is basically how the COC program developed throughout the nation. It was set up in a way that was easier for more urban and dense areas to access those funds compared to rural areas that have to do a lot more coordinating and organizing to get up. And so what you'll see across the nation is that balance of state COCs are really underfunded. They usually have a lot less staff than our more urban areas. But the same amount of work is put on their desks, and it's just that much harder because it is a more rural area. So I spoke a little bit about this, our continuum of care application. I really think this is important for folks to understand that this is a really valuable resource that we receive federally. Our continuum of care funds permanent supportive housing, rapid rehousing. It funds a transitional housing program in the Kenai, and also funds in part our HMIS system. We are not judged just by the applications that the agencies submit themselves. As I mentioned earlier, we do this larger application called the collaborative application, which is ranked against 404 other COCs in the nation. That collaborative application isn't just looking at those 13 grantees that we have as COCs, it's looking at the work that all of you do. So if we have really poor performance by non-COC grantees in large portions of the state, it pulls our entire score down. And so that's why we really look outside of just our grants area, which is just those 13 agencies, and try to make have a rising tide that rises all boats for that. And so a big piece of that is our system performance data. If you've noticed, we've had this big data theme over the last day. This has been an increasing portion of our overall score that we get every year. And it's really looking at these 6 measures. There's 7 measures, but they don't really look at one, so I don't even know why they have that 7th measure. But the 6, though, are length of time homelessness, returns to homelessness over a 2-year period, our point in time count, so number of people that are experiencing homelessness on a year-to-year, increasing income for participants, new clients entering homelessness, and clients exiting to successful destinations, so non-homeless destinations. And so it's really important that we as a community kind of think about these terms, because our state funding isn't the big picture. Our big picture is really those federal funding resources. That's a deeper pot to go in. And so when we're planning and we're having talks with funders and we're having talks with other stakeholders, this is really the conversation that we should be having, instead of kind of individually looking at all of our homeless response systems across the state in silos and trying to make them all unique. There are uniqueness in there, but this is really important. And as you can see, this has both the Anchorage Coalition on it and the Balanced State Coalition, then the Alaska average. It's interesting because the 2 COCs have strengths and weaknesses in different places, or room for improvement. But really, overall, I think we can do a lot of work together to improve these things going forward. And we've already made some pretty big strides on it. So really, what's our goal? It's to continue to develop this program and make sure that this funding continues to come to programs in the state. So we've been really successful over the last 3 years. We've increased our total funding amount. This year, we were awarded a rapid rehousing bonus project. We have good suspicion we're going to get bonus funding for another project as well in this cycle. That's really challenging to do, particularly when we took over this program. We were a very low scoring continuum of care, and that's because of a lot of those challenges. Real quick, the next thing that I wanted to mention, is our youth homelessness demonstration program. This is really the future. We did not have many options as a continuum of care program to increase our federal funding. Those bonus projects that we bring in, that's just incrementing us up like, 20 to 80,000 at a time, and that's a really slow climb. So we actually went to HUD and we were like, how the heck can we get more money in here? Like $880,000 a year for the largest geographic area is not much. And they said, well, you basically have to get your youth homelessness demonstration program. So we've been working to get this for 3 years, and wouldn't you know it, in the third year, we were actually awarded it, which was really huge. Yeah. So this was a huge application process. It took a lot of coordinating, but it's something that we're really excited about. Anchorage was a round 1 Youth Homelessness Demonstration Program grant recipient. And this afternoon, you're going to hear from Carletta and Dash about that program, and also from our youth about their work. But overall, only 1 out of 10 COCs in the nation have YHDP funding. We are really ahead of the curve, which is actually a really good thing to say for once, because it feels like we're always lagging behind what the lower 48's working on. But this is going to bring in $1.65 million over the next 2 years, and all that money that we put into programs annually will be kept in perpetuity going forward. That's new money, new programs, going forever and ever and ever going forward. That is massive. That overnight doubled the amount of federal funding we brought in the balance of state in just this one program. So that's why we talk so much about it. So this is a map of where, I just want to put this up to show how few communities have it. The different colors are just the round 1, round 2, round 3. What's really unique about Alaska is, since we do only have 2 COCs, we have full state coverage for our youth homelessness demonstration program. We're putting together a plan right now for the balance of state, but a big piece of our success going forward is to make sure that our 2 implementations are coordinated with each other, because our clients don't just access services based on the COC boundaries that we have out there. We have a lot of migration throughout the state. So we had a great stakeholder meeting at Covenant House with our statewide YHDP team a month ago, and it was pretty incredible to see what they've been up to and how we can move forward together. What's challenging is, so YHDP, it's a new federal grant in the scheme of things. It's only 3 years old. And so a lot of the communities that have been awarded it are, putting these implementations together in smaller communities. When we came across the table, we get a lot of technical assistance from our federal partners, and which I'm very appreciative of. But a lot of the times I go up and I'm like, how the heck did other communities do this huge planning effort over such a big, area? And they're like, you're like the first one. You're like, you guys are literally doing this the first, and everybody's looking at Alaska balance of state to figure out how to do this regionally. And it's like, oh, great. So, okay. So we don't really have, great technical assistance on how to do those like specific, unique challenges that we have. But somehow we're pushing forward, and one of the pieces of our plan requires us to put our stakeholders, like who's working on that, and that list is over 100 agencies long so far, and it's absolutely insane. And there's a lot more that are jumping on board as we get moving. So what can you expect going forward? We are currently in the drafting of our coordinated community plan for that. It's due by the end of April. We've been working on this since November. So we've have about, what is like 6 months total time to put this together, which is less time than the other two implementations were given by HUD because of some delays in the federal process. So we're right in the middle of that. It's a big push. It's every week. We have a weekly meeting on Thursdays. We've been meeting in person as a state team once a month for the last several months. And none of this work is funded through that resource. We have the ability to draw planning funds, but if we do one-time planning funds off of that, we lose that money in perpetuity going forward, and that's something we refuse to do. So this is a big challenge that we face. It's uncomfortable for me to talk about. I don't like talking about our work, and I just want to push forward. But that's a reality that we have right now. We have a youth advisory board that's Youth Alaska Action Board that up until about a month ago was doing a bunch of work and not being paid for it. We were able to secure a little bit of funding from the Alaska Children's Trust, and we're pulling in from our COC planning dollars to help them with their work, but still their budget's teeny tiny, and they're doing a lion's share of the Youth Homelessness Demonstration Program work as well, and I'm super appreciative of them. And they're amazing, but still that's something that we're trying to get through. Next phase, so this summer we're going to release a request for proposals to different regions, asking them to apply for Youth Homelessness Demonstration Program funding for new programs that will start in October. And so the plan that we're having is really going to outline, these are the needs in these different areas, and then we go, okay, different regions, tell us how you're going to do it, and here's the money for it. So those are the deadlines. I already went over that. So what's really our goal? So our goal is to establish those new programs. We're on pace for that. That's great. But at the end of the day, the $1.65 million is not enough to accomplish our goal of ending youth homelessness. It's just a start. And so it's really important that, other funding entities are taking a look at this work, this statewide regional planning that's happening, and understand that we need more help in that areas. And this is, we're always asked, well, give us a plan, give us a plan, give us a plan. This is the plan going forward. And this is probably a plan that has more input than any other housing or homelessness plan that's out there. And so, those are the conversations we're trying to have with our funding partners is, we need additional funds to help out with this. So I'm going to pass back to Scott.
Sure, and just one final piece on the youth homeless demonstration program. Now is the time, if you are a youth agency, to start having those conversations with your legislator about this program. Because when you're operating on the ground, you're going to want additional funding sources, and you're also going to want to know what your program and what your initiative, and that it's been a deeply planned, intensive community collaborative effort to get to the point of actually getting homeless youth programs in your community. The last slide, and this is kind of where we are operationally as a coalition. And a little bit of the strategies going forward. We talked a little bit yesterday about the Homeless Assistance Program grant and the cuts there, and how there were some cuts to the agencies doing the work. About 80% of the funds were recovered for those programs statewide. Our operating grant for executive director to do all of the great work that we've been doing the last 3 years was part of the Homeless Assistance Program budget, and ours was not restored at 80%, it was restored at 0%, so it was cut from the program. So that has left the board in a bit of a scramble here for the last 6 months, trying to figure out ways to patch in or find funding to continue having support staff for the things we were doing. The board of directors is committed to finding that funding, and as we see here in our future vision, that is the key priority at this point. We do have a board meeting in March where we continue to have discussions on development opportunities, as well as other grant sources to continue the work. As a membership, you may see more outreach and correspondence and requests for donations. So don't be shocked at seeing that sort of communication from us in the near future, as we need to fill an operating gap going forward. Again, that is, part of the short-term vision is to continue ongoing. There are other things that we've identified to enhance the work of the coalition that we've been pursuing in the past couple of years as well, which includes more collaboration and coordination with the Anchorage Coalition. Can we get funding for a youth homeless demonstration manager that's co-shared? Same with the COC program. We've looked at that opportunity because we know staffing concerns at the Anchorage Coalition are similar to ours. We've also had other conversations about, how does the successful youth homeless demonstration program look going forward? And again, it's not going to be one person does all multiple federal programs. Benefiting the network support for the programs once they get operating in 2 and 3. We'll need a YHDP program manager as well. And I don't know if there's a opportunity for a collaborative position there too. But these are things that we have already talked with funders and put out there in the state. Again, other pieces, continued improvements to the programs, continued advocacy on the state and federal level. I know our discussions about state advocacy this week has been really focused on budgets from last year and this year, and how to get those budget line items known to the legislature. But overall, in working with state agencies, there's a lot to be covered. Where do we go to have strategic discussions to enhance programs that already exist, or to get more permanent supportive housing into smaller communities? One of the things that I know, having worked on the local Housing First collaborative development project, is that the funding sources aren't clear. So when somebody in Kotzebue and Ketchikan and Bethel are going to be looking for how to develop permanent supportive housing, there's a maze to get through. And so there's ways to have the conversations to clear that funding up so it's easier. So there's a lot of state policy work to be done, and we feel like the coalition is in position based on the feedback from communities on being a part of that dialogue and wants to continue. Again, continued assistance for communities, that's why we're here. We do based on the work with our federal partners and with you on the ground, we feel like we have, we're primed position to provide that technical assistance and guidance for building this system moving forward, as we are the only governing and planning body really focused on continuum of care programs in the state. So that's kind of where we are as an organization. A lot of really good successes. They say, you never get to where you want to go in a straight line. So there's a little bit of a bump in the road as well. But we're pretty committed to continuing moving forward. And with that, I'll take questions. Brian or I will take questions before we move on to the next thing. Rhonda.
Brian, you mentioned there are 13 agencies getting the COC funding right now. If there was a 14th agency, are we competing against each other? Or would the 14th agency in your collaborative agreement give the opportunity for more funding?
Yeah, so we hold the annual funding competition that we have to, which is a HUD requirement. So with you as a COC grantee, you're applying every year and you're always going through a rank and review process. Since you're a renewal fund, I think your biggest concern about competition is just performing well in your system performance measurements. If there has been occasions where we have had poor performing programs that end up at the very bottom, and if we have a very strong new application that's coming in, it's for the COC board to consider whether they should do reallocation. And that's actually happened twice, actually, in the last 4 years. So So yeah, technically you're always competing against the other agencies, but we're also competing against the other COCs in terms of our own system performance and our fidelity to best practice models as well. Oh, and bonus projects, yeah. Well, also, if we do well, there's an opportunity. So let's say you were a new program that wanted to receive funding. When we send up that collaborative application to HUD, we indicate that different applications we'd like to see be funded through bonus funding, which is what happened with the Rapid Housing bonus funding that we got this last time, and then there's also a COC bonus. So those are not necessarily in competition with the other renewal applications, but they're just kind of in a separate funding category.
I have a question.
Yeah,
Can you
it's
hear? Okay, now it's on. I have a question about the data you presented, but it's basically going back to ask whether you guys have considered root causes for the homeless numbers, and if you've looked at what percentage of the population is attributable to the risk of going into homeless. In other words, there are categories, in public health we use it, there are categories of negative outcomes, and to each, when they do a multivariate analysis, there's a population attributable risk. So what percentage does domestic violence contribute? What percentage does alcohol abuse? What percentage does an incarcerated record? Not asking if you've done it, I don't see it in the data, but is it something that you are considering? And I ask that because it's something we're doing at Rural Cap, is we're trying to dig down to root causes so we can begin doing a risk stratification, figuring out strategically what do we want to address first. Does that make any sense?
It totally does. And it's something that we do on a regular basis. What we put up there was basically the HUD system performance measurements, and those are coming from the universal data elements that we're required to put into our system. When we engage in these planning processes, say for Youth Homelessness Demonstration Program, we're looking at multiple data points, not just in the housing world, but also where people are coming from before they enter our homeless response system. Why are they entering from those prior living situations? And what does our other data, such as like school data, tell us about us? What does the IBIS tell us about our clients, and how can we make improvements? Because it's not really just about housing folks, it's about surrounding them with supports that are tailored to their unique situation. And so when we do see like, hey, we're seeing a large population with substance use issues from maybe just this region, that's something that we have to go and address because it's going to affect all the other systems that those clients enter. So, yeah, and go ahead.
And I'd just like to add, too, that 2 years ago, or 3 years maybe, there was a Medicaid Accelerator Innovation program that the state participated in and took members from multiple sectors to take a look at how to triage complex cases amongst different kind of silos and areas. And so that program started and looked at the possibility of matching HMIS data with Department of Corrections data as well as Medicaid data to get a little bit at that, a little bit more concrete information as to the root cause issue, and then how to provide services and housing that complements that. I have not seen an update on that program. It was about a year intensive issue, but I think with the change of administration, I'm not sure if that's as big a priority as it was then. But the information's out there.
Is this on? Yeah. I just have a continuation of the answer, because currently all the regions that are at least showing up to the YHDP meetings, they're all doing workshops like right now that are trying to define the cohorts, those different sections of why someone became homeless or what they're struggling with. And so if anybody is from a region and you think there's information, that's like what we're trying to ask those questions again to get more data. But even then, it comes down to data and being able to ask someone their story. Is we want to be trauma informed, but then we're like, hey, I just met you, tell me your story. how did that happen for you?
So I have more of a comment, and it goes back to funding, and just kind of looking at the website. The Jeff Bezos Foundation has the Day One Fund, and I was pleasantly surprised to look at that this morning. They're contributing $100 million a year to homelessness. This seems like a prime candidate for some of those grant funds. And just looking at the website this morning, I saw that Catholic Social Services received a $5 million grant here in Alaska. So it is possible. We'd just like to see more Alaska names listed on that list next year.